So SGLT2 inhibitors lately, have made quite a fuss in pretty much, all the medical societies, and especially in cardiology, because they are approved for heart insufficiency patients, but amyloidosis patients have been excluded from these study protocols. So maybe there are still some amyloidosis patients in them, but they used to be excluded. So, but working with cardiologists, we were very interested in if it would make a difference. And the main concern in the beginning was, is it the same? Are the diseases comparable? Because amyloidosis, be it AL amyloidosis or ATTR amyloidosis, may not necessarily be, the half path we usually see. And the first step towards that was to evaluate the safety, as we usually do. And we were very quick in introducing those SGLT2 inhibitors in our patients because we had a good feeling about them and because the safety profile is very good. So from our data banks, we had quite extensive data on the safety, with the limit that we did not have a very good control group, right? Because they were tolerated very well, and we used to introduce them to our patients. And as is the case with transplant, there will be a reason if you do not give it to the patient. So what we did was a preliminary safety analysis with very good insight into the data. So we had a lot of data, and we found that they were tolerated very well. There were not a lot of patients who had to get off the medication, and the changes that we found were within the range that we expected from the large trials. And what we saw is that there's the usual drop in kidney function. There are the changes that you see when you have a concentration of the blood pool. So we saw all that, but overall the toleration was very good. We did not see any hints yet as to whether they benefit from it, because there was no control group. But following up on this, we have had other studies that confirmed that there may be a benefit. So we're excited to look further into this, and I think it's a great substance to look at in terms of amyloidosis.